Presentation about eHealth and health IT standards at the Ministry of Health, and due to the lack of time, we'll take 2 or 3 questions only because we have to start back at 12:30 inshallah.
Okay. So, questions? Okay, back up here.
What is the location of the event?
The location of the event, so if you contact me, keith.boone@ge.com, send me your contact information. I will get you added to a list and emails will be sent out on the location of the event. I don't know where the event is going to be held. My hope is we have an education facility that GE has co-developed with MOAs. And then my hope is that we're going to hold it there, but they're still planning.
Yeah,
And that would be King Faisal, if it occurs there.
I attended 2 of the workshops in the past 2 months. They were held here in Riyadh. Like one of them was held at Tiara Hotel. Mm-hmm. And also the Ministry of Health is having a collaborative excellence center with the GE that will start soon and teach health informatics courses. All these informations, you can talk to Mr. Boone directly or talk to me and I will connect you with the eHealth strategy office at the Ministry of Health.
Okay.
Question?
The other one's over here.
Thank you, Keith, for the nice and easy presentation about the standard and the Ministry of Health's eHealth strategy presentation. I have a quick comment and a question at the end. The comment is when we talk about standard, we have to always go for international standard at the beginning. We never think about local standard. We go for international standard because we need to communicate with the outside world, whether we give or take. And then we adopt those international standards to local, as you mentioned in your presentation. And we had the experience, if I can maybe talk about it, at one of the most advanced hospitals in Riyadh, where we have a standard HL7 system, let's say Cerner, but Cerner cannot cover all the information system or healthcare information system in the hospital. So they have other system, let's say oncology system, and we need to talk to each other. When we have patient admission, we need to send information on like the registry of oncology system. So HL7 at the beginning, they don't cover everything. So, and this is one problem. The other challenge or problem is we have many versions. So we have version 2.0, version 2.2, etc. And we have version 3, the latest one, which is good XML based. So what we did, so even with a standard, an international standard and everything, we still need people there to solve a lot of the challenges and problems. And we built, for one of my PhD students actually, we built kind of HL7 generator or engine to look at the destination system and see what is the version they use, and we create the version. So we have the information we'd like to send, we check the destination system, HL7 version or other thing, and we build the version needed for the destination system. So this
So if I bring a US plug to Vienna, I can't plug my computer in, because they use a different standard. So that's part of what problem you're having. Different versions of the same standard, but it's almost like it's a different standard. So it's close, but you still have to do work.
Yes, exactly.
Okay. So if everybody agrees to use the same version of the same standard, and when they pick their vocabularies decides, well, we're going to use SNOMED, and we're going to use LOINC, and we're going to use whatever else, GS1 codes for the packaging, and we're going to do the messages over in XML, and we're going to do that over TCP, and we say, this is the set of standards that we're going to use in Saudi, and when we buy systems, we will identify this list of systems that we will buy. Then you wind up with your oncology system and your HIS system. If they've been bought, specified the same way, then they talk together much easier. And it's not just a matter of plug and play. I can't just plug it in. I might have to do a little bit of work in configuration, but if they claim conformance to that set of standards, then it works together. This is the strategy that is being taken through the Strategy and Change Management Office. And Dr. Belcaire, who's presenting this afternoon, he's actually the Director of Strategy and Change Management at MOH. He's actually leading up the standards project from that perspective. But this is the strategy that they're setting, and we're helping with them deliver.
Are you going to be here from 3 to 4 today?
I am going to be here all day.
Sure. So we can hold the questions?
Yes. Yep.
Thank you. Thank you.
Thank you. Thanks a lot.
So thank you.
So we'll meet inshallah at 12:30. Thank you. السلام عليكم ورحمة الله وبركاته. Dear Dr. Abdurrahman Al-Muammar, the Vice Rector for Health Specialties, dear college deans, dear guests of honor, distinguished invitees and students, Assalamu alaikum wa rahmatullahi wa barakatuh. On behalf of the Medical Informatics Unit and the Medical Education Department in the College of Medicine, I have great pleasure to welcome all of you to the Essentials of Health Informatics ceremony. To begin the ceremony, I would like to invite Dr. Amr Jamal for the Quran. Okay. Quran citation first.
أعوذ بالله من الشيطان الرجيم والله أنزل من السماء ماء فأحيا به الأرض بعد موتها إن في ذلك لآية لقوم يسمعون وإن لكم في الأنعام لعبرة نسقيكم مما في بطونه من بين فرث ودم لبنا خالصا سائغا للشاربين ومن ثمرات النخيل والأعناب تتخذون منه سكرا ورزقا حسنا إن في ذلك لآية لقوم يعقلون وأوحى ربك إلى النحل أن اتخذي من الجبال بيوتا ومن الشجر ومما يعرشون ثم كلي من كل الثمرات فاسلكي سبل ربك ذللا يخرج من بطونها شراب مختلف ألوانه فيه شفاء للناس إن في ذلك لآية لقوم يتفكرون.
We thank Mr. Abdullah Al-Mazrou'i, fourth year medical student. Now I would like to invite Dr. Amr Jamal, the head of Medical Informatics and Electronic Learning Unit at the Department of Medical Education, to give the welcome speech.
Alhamdulillah, salatu wassalamu ala rasulillah. The Honorable Vice Rector for Health Specialties, the Acting Vice Dean and Vice Dean of this college, and Chairman of Medical Education Department, Chairman of Medical Informatics and e-Learning Unit on Oregon Health and Science University, Professor William Hirsch, or Bill as he likes us to call him. Assalamu alaikum wa rahmatullahi wa barakatuh, everybody. It's my honorable to stand over here on behalf of the organizing committee for the KSU OHSU i10x10 Essentials of Health Informatics training program. This organizing committee has been working for the last 12 months since the initiating the agreement between Kingston University and Oregon Health and Science University to start this training program 12 months ago. But the program effectively started 3 months ago, and today we are celebrating the graduation of 36 students who passed or almost passing the program. These 36 students, not all of them are physicians, not all of them are from Kingston University. We have got 3 students from Malaysia, others from outside Riyadh, others from outside Kingston University. We have got 20 students from King Saud University. The remaining are from outside. They have got finished for 3 months online interactive course about different elements on the medical informatics or medical and bioinformatics, and they have finished also some interactions in-person sessions in yesterday and today and for the coming 2 days, inshallah. And we are celebrating that today. If I give this talk, maybe 5 years ago, I need to present the evidence, what's the importance of medical informatics. But nowadays, there is no doubt of that, so the changes must. And part of change and to overcome the resistance is to train people what's the importance of medical informatics. And this is part of the training people. And I would like to quote one of the students' feedback that we heard yesterday, that we would love to have that course before starting our EMR or eSahi project, to know how to deal, how to design, how to deal with the vendor. But nothing is too late, and we are moving, and we hope that we have got repeating this course again and again every year. So please join me to thank everybody, and last not least, to thank the organizing team for this course, who worked hardly since the signing the agreement and starting the background of this big project for the last 12 months. Thank you, everybody.
Our next session is going to be an overview about 10 by 10 course. We would like to invite Professor William Hirsch for this session. Professor Hirsch is a leader and innovator in biomedical informatics, both in education and research. In education, he developed and serves as the director of all graduate biomedical informatics education programs at Oregon Health and Science University. Dr. Hirsch also serves as the director of OHSU National Library of Medicine funded training grant. Dr. Hirsch has won numerous awards of his educational innovations. These include the Amia Donald A.B. Lindbergh Award for Innovation in Informatics in 2008, and the Modern Health Top 25 Clinical Informaticians Award in 2010, 2012, and 2011 and 12. Dr. Hirsch also made many contributions in research. His most recent work has focused on the workforce needed to implement health information technology, especially in clinical settings. His research originally focused in the area of information retrieval, where he authored 133 scientific papers and numerous other abstracts, editorials, and book chapters. The book, Information Retrieval, A Health and Biomedical Perspective, was written by him. Please welcome Dr. Hirsch.
Yes. And this is well, thank you. Thank you for those kind words, and thank you for inviting me. Thank you, Dr. Jamal, or Amir, as I like to call you. And it's been a real pleasure. I can't say that I've yet seen a lot of Saudi Arabia. I've been here about 36 hours, and part of it sleeping because my plane was delayed out of Frankfurt. But I'm hoping over the rest of the week that I'll see more than the inside of your medical center here and see around your city and elsewhere. I was asked to give a short overview of the 10 by 10 program, and that I will do. And so I will, let me see. Is this, what? Up and down? Okay. So in this short talk, as I always do, I will cover a lot. I'll talk about the history, enrollment, evaluation, what we do in the course, the i10x10 program, and future directions. And these slides were actually adapted from a panel that we put together at last year's MedInfo meeting in Copenhagen, Denmark, where we talked about the internationalization of the 10 by 10 program. But let me give you just a brief history, like where did the name 10 by 10 come from. Some of you may know Dr. Charlie Safran, who in 2005 was the president of AMIA, the American Medical Informatics Association, and was one of the first people to take up the banner, just like we heard people wanting more here, that there should be more physicians, nurses, others in healthcare who are trained in informatics. And he looked at the fact there's about 6,000 hospitals in the United States, and if you trained one physician and one nurse, there would be a good capacity to understand. This was, of course, before the huge explosion in use of electronic health records in the U.S., which I'll talk about tomorrow. Anyways, he said to people like myself, about 2 or 3 dozen directors of informatics educational programs at that time, how much could you increase your capacity? And most of the training program directors said, well, we could probably increase our enrollment 2 to 3 times. And Dr. Safran always chuckles because I said, all of them. We can do them all. Distance learning is very scalable. We were one of the early distance learning programs to use distance learning. And we actually had an introductory course at that time in our graduate program that is essentially the same as the 10 by 10 course. And from my vantage point, I thought given long enough lead time, there would be no difficulty in really expanding it up. So I said, yeah, we could, this was 2005, I said, yeah, we could train 10,000 people in informatics by the year 2010. I wasn't sure we could really do that. But in any case, that's where the name 10 by 10 comes from. And of course, we're now in 2014, and the 10 by 10 course, as you'll see by some of the statistics, continues to be popular. And so it's one of those names like ASTM that just doesn't have the original meaning anymore, but it continues on because it's of value. At the time, in 2005, as I mentioned, OHSU had this distance learning capability. The technology wasn't that much different than it is now. Obviously, the Internet's gotten larger and faster. In any case, we started our distance learning in 1999, back when most people accessed our materials over telephone modems. Some of you remember those. And we first developed what we call our graduate certificate program, an 8-course subset of our master's program, and then actually launched our full master's program online. Distance learning is very scalable and probably almost infinitely so. We see things today like massive open online courses or MOOCs. And on the other hand, our program isn't just one that we want to broadcast out without faculty involvement. So we do need enough faculty and staff to handle it, but otherwise is very scalable. And we adapted this introductory online course to become 10 by 10. And what we did was we thought we would add an in-person meeting at the end of the course. Most of the original courses took place in the U.S., and people from the U.S. would come typically to an AMIA meeting. When we started going international, that would seem a little bit more challenging. So being one who likes to travel around the world, I had no objections to going to places, as you'll see, like Argentina, Singapore, and now Saudi Arabia for these in-person sessions. The 10 by 10 program launched pretty quickly. We came up with the idea about February of 2005. We then put together a memorandum of understanding. It was this mutually non-exclusive memorandum of understanding so that AMIA could have other universities offer 10 by 10 courses, and we, of course, could continue to use our course material in any other way we wanted. We were up, because the course already existed, we didn't have to do a lot of new development. So the program was launched in June. 51 people heard about it. We didn't do a massive amount of advertising, but on the internet and other places. And 44 of those people actually completed the course, and a good proportion of them attended the in-person session. One of the people who attended was Dr. Paula Otero from Buenos Aires, Argentina, and actually about a year later led an effort to translate the course into Spanish. And as I'll describe more in a few moments, that's been very successful. And AMIA subsequently has had other 10 by 10 courses that have been developed. Many of them focus on specific areas such as usability, clinical research informatics, public health informatics, and so forth. We've had a lot of different partners in 10 by 10. Most of them have just been one-time partners, but some of them have become more significant, again, starting with Dr. Otero's hospital and university called Hospital Italiano de Buenos Aires. Another major partner has been Gateway Consulting, run by, some of you may know, Dr. Casey Loon, who used to be president years ago of the International Medical Informatics Association from Singapore. There's a couple medical groups that have had repeat courses, and now hopefully King Saud University will become part of this as well. When we partner with other organizations, we sometimes add co-faculty, like we did with Dr. Jamal and Dr. Zakaria. And one challenge we've had is that the course is somewhat U.S.-centric in nature. I know that not everyone in the world wants to learn about HIPAA and Obamacare and all that. And so we've tried with the Singapore course, and we can look at this with the Saudi course as well, of trying to add some more local flavor to it. And then we hold this in-person session. This just plots out the enrollment over time. We probably coinciding with the big financial investment in the U.S., 2012. Actually, I have 2013 should be on here. I don't know where it went. Anyways, we've had about 1,600 people, so not quite 10,000, although we've never turned anyone away, so we could probably handle more people if they came forward, but 10,000 people didn't show up at our doorstep wanting to learn informatics. This is a figure from a book on informatics education by Dr. Ida Berner. It just shows you the different institutions that have offered 10 by 10 courses, and as you can see, our course has really been the flagship course for the program, but other programs have been successful as well. There have been a number of different evaluations of 10 by 10. I won't go through these, but if you're interested, some of them you can look up. They've been published. Others are documents that are available elsewhere. I always get a chuckle when the Gartner consulting firm does an annual survey of chief medical informatics officers, and they asked in this survey what their the training was that CMIOs have. Interestingly enough, the highest is none. It's another phenomenon in informatics that many people have no formal training. But after none, the second highest was the 10 by 10 course. I won't go through this in a lot of detail, but we make use of a lot of distance learning technologies, and the 10 by 10 course is always offered in two parts, with a longer online part. Dr. Jamal mentioning that it's been going on for several months, and then we have some kind of intensive, in this case, 2-day session. And because we offer the course multiple times in the U.S., people don't necessarily have to come to the in-person session that's connected to their course. We make use of a number of different modalities for teaching, although there was great feedback yesterday on ways that we can improve that. But the staple, pretty much back since we started doing distance learning, is voice-over PowerPoint lectures. These are delivered using flash technology, although finally the system that we use to develop these, called Articulate Presenter, the newest version, can now create output in HTML5 and display it on mobile devices, which we're finally catching up to the mobile age. And we don't just push information out. Our discussion boards are highly interactive. I've engaged in a lot of interesting online conversation with everyone in the course over the last few months. We do give some reading assignments, and we also give some homework quizzes in the form of multiple choice questions that can, of course, be easily graded by our learning management system. This is just a screenshot of a slide. If this were a real slide, you would hear me talking. You can navigate through the different slides in each part of each unit, and you can go back and forth. It provides a nice way. If you miss something, you can go back and listen again. If there's something that you think you already know, you can skip through it, etc. I always find it interesting, since I've actually been teaching this course probably now for about 20 years, and it's always fascinating for me to go back and look at the materials that were in this course. This is an introduction to, back when we called it medical informatics, now we tend to call it biomedical and health informatics. But the topics have changed. Back in 2005, there were the phrase "meaningful use" had no meaning to anyone. Things like health information exchange were just getting going, and things were just organized differently. But this is how it is now, and I'm sure it will continue to evolve. Of things that we haven't even heard about or thought of yet. Another exciting event for me has been the international adaptation of the course. I've always enjoyed interacting with students from other countries, other cultures, and 10 by 10 has actually proven a nice vehicle to do that. We actually have always had enrollment, international enrollment, dating back to the beginning, 10 by 10, not only Dr. Otero from Argentina, but places like Hong Kong, Pakistan, Australia, I could probably list them on, Singapore, etc. The first truly international effort was this one with Argentina, and Dr. Otero and her team translating, initially really just doing a translation. But since they did that initial translation, the course has developed much more of a Latin American perspective to it. And they've now offered it to over 1,000 people. And in fact, it resulted in us being awarded a grant from the U.S. National Institutes of Health, the Fogarty International Center, that enabled us to expand our collaboration. There are now students from Hospital Italiano that come to Oregon, and vice versa. The success of this led AMIA to come up with a plan. This